Welcome to the HEAR educational module, Accessing NHANES Data to Support Environmental Exposure Studies, an Investigator's Guide. The objectives of this module are to understand what the National Health and Nutrition Examination Survey, or NHANES, is and what types of data it contains. Understand how NHANES data can support HEAR applications. And finally, be able to access NHANES data. So what is NHANES? The National Health and Nutrition Examination Survey, NHANES, is a broad, population-based survey conducted across the U.S. population. Participants are selected based on demographic characteristics. As part of NHANES, biomonitoring measurements are made using samples from participants. This process is conducted by CDC's National Center for Health Statistics. NHANES is designed to collect data on the health and nutritional status of the U.S. population. Beginning in 1999, NHANES became a continuous survey, sampling the U.S. population annually and releasing the data in 2-year cycles. The sampling plan follows a complex, stratified, multi-stage probability cluster design to select a representative sample of the civilian, non-institutionalized population based on age, gender, and race/ethnicity. Note that the NHANES website is provided at the bottom of this slide. This and all other links provided in this video are also available in the slides available on the HEAR website. The NHANES conducts the quantification of exposure and captures long-term trends of known exposures across the U.S. population. Chemicals of potential concern, such as arsenic and environmental phenols, continue to be added to NHANES, with the most recent report including data on more than 400 chemicals. An output resulting from NHANES biomonitoring is the National Report on Human Exposure to Environmental Chemicals. Currently, this report contains nationally representative and cumulative biomonitoring data from 1999-2000 through 2017-2018, though this is continually expanded with new releases of data. This includes individual and pooled blood or urine samples that were tested by the CDC. The samples are from NHANES participants, which are representative of exposures in the U.S. civilian population. The NHANES biomonitoring data are informative regarding prevalence data on disease trends, though they are not able to provide assessment of disease exposure associations. Please note that the report does not provide health or toxicity information, state or community-specific data, specific product or environmentally related information, regulatory guidelines, or recommendations. Also, note that full datasets can be downloaded from the NHANES website. Now that we have discussed what the report is and what it includes, let's discuss its uses. The overall purpose of the report is to provide specific information to scientists, physicians, and health officials to help prevent exposure to environmental chemicals. Examples of public health uses of the exposure information in the report include to determine chemicals and concentrations getting into U.S. residents, to determine the prevalence of people with levels of chemicals above known toxicity levels, such as a blood lead level greater than or equal to a specific concentration, to establish reference ranges that can be used to determine whether a person or group has an unusually high exposure. This information is especially helpful to identify population groups that merit further assessment of exposure sources or health effects, to assess the effectiveness of public health efforts to reduce exposure to specific chemicals, to track trends in levels of exposure of the population, including among potentially vulnerable groups, such as minorities and children, and to set priorities for research on human health effects. So now you may be wondering, how can this help support HEAR applications? HEAR provides services for analysis of human and environmental samples from human health studies to measure environmental exposures. While it is important to note that NHANES does not include information from environmental studies, such as those with air, water, or dust samples, NHANES biomonitoring data can be used to complement proposed HEAR studies by providing information regarding population exposures. For example, the NHANES biomonitoring data can allow you to look at population data for the total population, such as ages 3 years and up, gender, years, and other demographic categories. Here's an example of a data table from the report for bisphenol A analyzed from urine samples between the 2011-2016 study years. Demographic categories include total population, for which, depending on the survey year, may include ages 6 and older, or, in a later year, ages 3 and older, as well as age group delineation for participants under 20 years of age, grouped as 3 to 5 years, 6 to 11 years, and 12 to 19 years. It also includes binary gender categories and several race/ethnicity categories. Overall, NHANES data can provide guidance on what emerging contaminants are observed in populations, as well as the legacy contaminants. These can subsequently support the understanding of the feasibility and importance of a proposed study. Now we'll provide some guidance for what to look for in NHANES data when considering how to use it to guide a potential study. First, you may want to consider: is NHANES detecting a compound of interest in your cohort during the years of biospecimen collection? If yes, when did NHANES start detecting the compound? And when was the last date of assessment? This will help you gauge if NHANES contains information relevant to your research questions. You might consider if there is evidence of a temporal trend. For example, were concentrations of the compound higher in specimens from 1999 than 2008? Then, how does that compare to 2016? This is, of course, a hypothetical example. You would consider this in context with what year's biospecimens were collected from your cohort. But this type of consideration will help you determine if the data in NHANES supports the feasibility and significance of your study. It is also important to consider the overall NHANES or subgroup comparability or non-comparability of results compared to your cohort. If the samples aren't strictly comparable, since one is population-based and the other is selected on specific characteristics, it may be helpful to see what a cohort exposure is like, compared to a nationally based sample. One example of this is a study from Graber et al. Published in 2021 used NHANES data on PFAS to study exposure among volunteer firefighters. Researchers compared PFAS distribution and serum levels among volunteer firefighters in their study and compared these to the NHANES data among non-Hispanic white adult male participants in the 2015-2016 and 2017-2018 NHANES survey cycles. This study found that while serum levels fluctuated by PFAS compound, serum levels of PFDOA, PFNA, and PFDA in the study were elevated in male volunteer firefighters compared to NHANES data on demographically similar members of the U.S. population. A second example of the utility of NHANES comes from a study by Rahman et al., published in 2022, assessing environmental metals and chemicals and chronic obstructive pulmonary disease, COPD, in the adult U.S. population. This study used the 2013-2014 and 2015-2016 NHANES dataset to conduct a cross-sectional analysis and included 14 urinary metals, 7 polycyclic aromatic hydrocarbon or PAH compounds, and 7 arsenic species concentrations. While it is established that a primary risk factor for COPD is smoking, environmental factors and occupational exposure are also known to increase the risk of COPD. This study, which included adults aged 20 years and older, assessed metals, arsenic species, and PAHs that were provided in the NHANES datasets. Additionally, in the study, COPD was determined using NHANES medical conditions datasets. Datasets for covariates, including demographic categories, alcohol consumption, body mass index, and serum cotinine, were included. Note: the image shown is a screenshot of the summary statistics table with demographics related to COPD from this study. This study's figure shows the dose-response plots of participants with COPD for the urinary metals. Strontium and cesium have higher concentrations in those with COPD, while molybdenum has a lower concentration in those with COPD. There were visibly higher concentrations for 2 PAHs in this study for those with COPD compared to those who did not have COPD. Among the speciated arsenic, most of these analyzed demonstrated concentrations that are lower in those with COPD. Overall, the study found a positive association among urinary tin, cadmium, and 7 forms of PAHs with having COPD among U.S. adults. Since the data used in this study were from NHANES, the findings are limited by the method of COPD data collection. The COPD data were obtained by questionnaire from the participants. They were not confirmed with pulmonary function testing with laboratory spirometry. This highlights the opportunity to further explore these environmental associations with COPD and other respiratory outcomes. Some additional points to consider when using NHANES data include: what is the level of detection for each compound of interest? In some cases, methods have been optimized over time, and exposures that weren't detected as frequently in the past may have been limited by the methods of detection. This may become evident from observing increased detection over time corresponding with lowered limits of detection. The analytical limit of detection, LOD, for chemical measurements are provided in the Biomonitoring report. LOD values are reported by survey periods since LODs will often change as analytical methods improve. NHANES data can provide direction to what exposures of interest may be most appropriate for an investigator's cohort. It's important to remember that NHANES data does not have limitations given the number and composition of general population participants. For example, the Asian population group is included in some of the NHANES data, but not continuously since 1999. This is important to consider, especially if you have a specific cohort population, including one that is not in the United States. While NHANES data can still provide insights into what exposures are being observed for general populations, note that there may still be unique exposures in your cohort that would differ from the NHANES results. Check out the HHEAR Environmental Exposures module for more information. Finally, we will walk through how to access data from the National Report on Human Exposure to Environmental Chemicals. This report is accessible on the CDC website, provided here. From this main page on the website, updates to the exposure report and resources such as biomarker groups and the list of chemicals included in the report can be found as PDFs under the Chemical Information header, as highlighted by the orange box. To access the biomonitoring data tables, click on the Biomonitoring Data Tables for Environmental Chemicals image located at the top of the National Report on Human Exposure to Environmental Chemicals page, or visit the direct link to the data tables webpage. Note that previously this report was made available as a PDF. Now the data tables can be viewed by searching the Dynamic Data Tables. On the Biomonitoring Data Tables for Environmental Chemicals site, there are 3 main steps for accessing information. Please note that a user guide is provided with instructions for how to search and view the data tables. In the 3-step process, you will make 3 selections. First, the sample type. Second, the chemical name or chemical group. Note that there is a chemical group name list for guidance if you need support getting started. Note that there is a chemical group name list for guidance if you need support getting started. Once you make a selection, a table is generated on the dynamic website, and there's an option to download the table as a PDF. Finally, under Step 3, if you want to view additional tables relating to the same sample type selection, select another table viewer and then go back to Step 2 and make another chemical selection. The tables generated include demographic categories, survey years, geometric mean, and selected percentiles of concentrations and the sample size. The limit of detection, summaries, and fact sheets are provided for the selected chemical or compound. Shown here is an example of a table output for phthalates from NHANES survey year data available from 2013 until 2018. Interested in utilizing NHANES as a resource to support your HHEAR application, but still feel like you need more guidance? Contact the HHEAR Coordinating Center to schedule a pre-consultation meeting. During this meeting, you will be connected with scientists from the Lab Hub or Data Center to address your inquiries. You can see more resources, including how to apply and eligibility, at HEARprogram.org. Included here are several relevant resources for accessing NHANES biomonitoring data. Thank you for listening.